Your imaging's all normal, but yet your pain persists. This is one of the most frustrating things with chronic pain and is very normal and actually very explainable. Here's why. The source of your pain is just not where you're feeling your pain. We're so used to acute pain where you feel the pain where the tissue is damaged. But chronic pain plays by a separate set of rules. And if you have things like central sensitization or neuroinflammation, these are central nervous system issues, not a tissue level issue. So your x-ray, your MRI is almost always going to be focused on where you're feeling the pain, not on your brain and central nervous system. And even if you were so fortunate to get that imaging, these things don't show up even on MRIs. If you wanted to see central sensitization, you'd have to get a biopsy of your spinal cord. And they would have to use very high powered microscopes to count out the actual number of inhibitory interneurons and see how they're working. That's going to happen more in a research setting, not a clinical setting. So you're just not going to get that. And then neuroinflammation. On MRIs, you're only going to see gross amounts of fluid, what you can visually see with your eyes. That's like a brain bleed or acute inflammation. But chronic inflammation, you can't see with the naked eye, and therefore you're also not going to see it on an MRI.